talk, autism spectrum disorder. This was a girl. Case history, chief complaints, fearful of little things. Please ध्यान से देखिएगा केस को. Note down the peculiar things and you will automatically go to the Psora. Fearful of little things, loud noising, fighting others, loud voices. She was fearful of all these things. Memory weak, unable to remember. What she has studied cannot copy. She says, listen from me whatever I have memorized, otherwise I will forget. She always say to her mother, listen to me. Irritable nature, when asked for food, to go outside, say no for everything. She was no for everything. No, I don't want to go. I don't want to go to the market. Always reacts in anger. Do not speak in loving tone. Angry mein, nahi maine nahi jana. I don't want to go. She was angry. Talks in sleep, sometimes walk. Neend mein chalti thi. Nail biting. Fearful from father. She was very fearful from father. Only calls father when wants something. Fearful when he touches her. Never slept in front of the father. Sits near him but in a fearful state. She was very scared of father. Stubborn. When we want to go, where we want to go, we need what we need. If she is not given anything, weeps with headache. She wants everything promptly. When her mother did not give her, she used to weep. Eats chapati with salt, nothing else. Eye contact poor, always look downward. Poor concentration, do not focus on studies, only reads. Try to learn it or otherwise, then only writes what reads, doing work in a linear way. Do not do homeworks, run away from studies. She was very weak in studies. Concentration was poor. Past history में milestones delayed. Sitting was at 9 months. Third year में teething आई थी. Fourth year age she was started walking. Speech was delayed at 8 years of age. Started speaking complete words at 8 years of age. Abdominal pain. She was suffering in the past, 2020-21 treatment. Now, sometimes while going to school, she was suffering. Otherwise, she was normal. Episodes of unconsciousness. When 7 months old, scissors took allopathic treatment. She was 7 months old when scissors came. Recurrent cough, 6 to 7 months she's having. Constipation since 5 years. Likes to get ready as a bride. Copies what bride do. This is her mother's version because it was a one-sided case, so mother history. Teachers acting, making other kids learn how to do work. She does teachers acting. Choosy for bangles. Likes dancing and dancing. Cannot bear anyone touching her. Even touch of parents she cannot bear. Attached with Tayaji's cousin brother. Whenever she gets new things, shares it with them. Cares for him more than her parents. मतलब उसके साथ she was having full attachment. Doesn't like to play outside. Play on the phone only. Visit Tayaji's home, then come back fighting with them, and then again go with them, play and them. Whoever stops her from doing anything, do not like her, gets angry on him, clenches her teeth in anger with him or her. Whoever stops her, she gets angry. She is very abrupt, never talk lovingly to anyone. She wants to be alone, do not want to get mixed up in the family. Always wants to go to Tayaji's home because there she has no restrictions. There she can use phone also. So she did not want it to go to others' home. Sleeps with mother, wants mother always with her, but cannot bear the touch. Sleeps with back towards mother. Touch nahi chahiye. She sleeps, but with the back towards her mother. Hits the others only to the known ones. Whatever she is going to talk, hits the other person and then talks. Loves the children, picks them up in her lap, holds and loves them. She does not understand good things and bad things. There was no understanding for this. She is very clean and wants everything in proper manner, likes to keep things clean, do not want anything dirty. Very fastidious. Now in pregnancy history, 3rd month, mother had bleeding. Doctor said, bed rest. So I remained in the bed for 9 months. But now I regret this thing that whatever we are facing now would not have been there if I would have walked. This is mother's version. She says that doctor told me to rest and I was fully on bed rest. But now I see that my child is like this, maybe due to this, because I did not walk. Vomiting daily after dinner till the whole 9 months. Whole 9 months she was vomiting. Delivery was normal, but birth cry was absent. Till 6 months, no crying. Only lying down, thumb sucking, Feeding was not proper, appetite was less, only wanted mother's company. So first thing which you should be alert is birth cry was absent, and birth cry was absent, that means the brain did not get the oxygen, the lungs did not breathe in and the brain did not get the oxygen, and there was hypoxia of the brain. ये पहली चीज जहां पर, that means the child is carrying something from the mother. That means the child's amygdala is already in alert from the mother. That means the child's subconscious mind, her primitive brain, is already pre-programmed from where? From the mother. That means the Psora has traveled from the mother to the child. I used to feel, now this the mother says, I used to feel loneliness. I was all alone lying down. It was difficult lying down on the bed. I was fed up lying, and it was like a cage for me. Inside, I used to feel that they should say me that you should move around and walk or work something. She used to say that somebody please say me that go out of the room. Somebody please say me that you walk a little bit outside. Let's go for a ride. Let's go for a drive. But nobody said. Why? Because the doctor said you have to be on the bed rest. Jethani is the elder sister-in-law and mother-in-law used to care for me too much, more than my parental family. Yani ke mother-in-law was so caring. Father-in-law used to drink, but father-in-law used to drink alcohol and come home abusing my sister-in-law and brother-in-law, Jeth and Jethani. He used to throw away all the utensils. I used to feel that we should not get separated, as I like to live in joint family. This was mother's version. Mother said, I used to feel that because of these fights, we would not get separated. I wanted to live in joint family. I do not want to go to a neutral family. I like living in joint family. Before marriage, there were no fights. No one used to drink at our home. Finances were stable. This is mother's version. Mother said, I came from a family, there was no alcohol. We used to live together. We used to laugh. There were no fights and we loved each other. But here, this kind of situation came. There were separations in the family due to finances. There were fights among the brothers in this in-laws family. But we means the sister-in-law and she, Jethani and Devrani, were very attached and did not want to separate. We still wanted to live with each other. We do not want to separate homes. In the pregnancy time, she says, when the patient's mother, the child's mother, was 5 to 6 months pregnant, Bhua and her daughter died in an accident. This mother's Bhua and daughter died in an accident, and she had a doubt that something has happened, but nobody told her during pregnancy. The Bhua and the daughter died in the accident. Patient's mother had OCD. Now, patient's mother, the child's mother, was having OCD in pregnancy. She was washing hands again and again and again, checking the locks, and she was, after her babies, this was her condition. The patient's mother's mother-in-law, yani ke saas, was very nice. She handed everything to us. We used to buy clothes for her even. But father-in-law, we were scared of the father-in-law, that our children might not copy him. Patient wanted to go to school. She was very weak. She was fearful. She used to sigh in fear. This is our patient. She used to sigh in fear. She used to be very weak. She used to suck the thumb and heavy breathing like this. And she was sucking the thumb. Teacher said, please don't send her to normal school. She will go to special school. She will not be able to cover the syllabus. She studies poorly. This was what our patient's teachers told the mother. Teacher used to say that she never speaks anything. Yes or no. She does not even utter, not even make noises, no mischief. Right? So हमारी जो patient है कौन सी category में है? Externalizing EBD or internalizing EBD? Everybody. Externalizing or internalizing? So our patient is in internalizing EBD because she gets everything internal. Patient's nani, this is the parental history. Patient's nani was a housewife and had 2 daughters and 2 sons. Patient's mother, mama, masi, and again mama. Finances were very good. Never saw any financial lack. नानी was ill. So patient's नानी यानी मदर की जो पेशेंट की मदर की जो माँ थी, she was ill when patient was 14 to 15 years. Then patient's दादी took care of पेशेंट्स, जो मतलब पेशेंट्स की जो मदर की दादी है, she took care of the patient's mother. Right? This is now mother's history going on. मदर की जो मदर थी नानी, शी वॉज इल, सो मदर की जो दादी थी उन्होंने उसकी टेक केयर की, और मदर की बुआ थी और उसकी बेटी थी, बुआ एंड द बेटी, जिन्होंने टेक केयर की, जिनकी डेथ की खबर प्रेगनेंसी में आई, जो पेशेंट तक, पेशेंट की मदर तक नहीं पहुंच पाई, बट दो डेथ ऑफ द बुआ एंड द डॉटर एक्सीडेंट में हो गई थी. ब्रदर सिस्टर्स वर यंग. There were always a fear that something would not happen to the mother. Nani, because Nani was sick, so patient's mother says, I was always in a fear that my mother को कुछ हो ना जाए, मेरी mother को कुछ हो ना जाए. Bua and her daughter used to stay with us. They took care of patient's mother and household responsibilities. Bua and daughter remained with that patient's mother as she was 1 year older, and patient's mother was very attached to her, as she used to listen to the patient's mother. As mother said, she used to do everything. When patient's mother came to know about her death, mother was in shock. जब बुआ की डेथ की खबर सुनी पेशेंट की मदर ने, she was in shock. Patient's mother was married at an age of 21 to 22 years. As family said, I did that. Mother's nani and nana. Patient की जो mother की नानी और नाना, nana died early. Patient's nani was young. Mother's nani took care of all the things, took the responsibility. Physical generals, chilly hai, thirst for sips of water, no sweat, desire salty things, aversion to sweets, urination frequent, stool is constipated, sleep is increased, walking, talking in sleep. So how we are going to analyze the case, right? Let us trace the Psora of the child. How this child got sensitized to land in the state of ASD or ADD. We have to see if there is a past connection of the disease with the transgenerational programming. We will have to correlate few of her things with the pathological state, right? Pathological state. Pathophysiology. Intrauterine exposures such as maternal psychopathology and stress are known to influence the physical and mental health of the offspring. One of the proposed pathway underlying these association is dysregulated hypothalamus pituitary adrenaline axis to the offspring. This I have told you. Patient की mother stress में थी. क्या क्या stress था उसको? कि कहीं एक तो कि मुझे अकेला छोड़ दिया. I was told to be bedridden. There was no one with me, right? पहले अकेली हूं. I want to go out. दूसरा, there are fights because Dadaji was, the patient's Dadaji was very quarrelsome. He used to come, he was very strict and he used to fight with the Jeth and Jethani. ठीक है? उनका डर, fear, and ये डर कि कहीं दादाजी सेपरेट ना कर दें हमें फैमिली से. I wanted to live in joint family. कहीं दादाजी सेपरेट ना कर दें. ठीक है? If दादाजी would separate us, then I would be alone. उसके बाद पेशेंट की नानी was ill. पीछे चले जाओ. पेशेंट की नानी, because Psora travels from generation to generation. नानी ने क्या सिचुएशन देखी? नानी was ill and patient's mother's 12 to 14 years में उसने देखा कि मेरी माँ बीमार है तो केयर टेकिंग कौन कर रहा है? दादी. फिर दादी की डेथ हो जाती है. फिर केयर टेकिंग कौन कर रहा है? बुआ एंड डॉटर. और प्रेगनेंसी में उनकी डेथ की खबर आ गई, राइट? तो मदर, दादी एंड बुआ एंड डॉटर, तीनों जो केयर टेकिंग कर रहे थे, तीनों डेथ. ठीक है? तो नानी और मदर की जो नानी है उसने क्या देखा पीछे? उसने क्या देखा? नाना की डेथ, अपने नाना की डेथ, अपने फादर की डेथ. मदर ने अकेला पाला, पर नानी ने नानी को. ठीक है? और जो नानी है उसने क्या मदर है उसने क्या देखा? मेरी माँ बीमार, मुझे नहीं पाल रही है, राइट? तो ये व्हाट इज ट्रैवलिंग फ्रॉम पर नानी टू मदर एंड नाउ टू आवर चाइल्ड who is our patient. Psora going on from generation to generation, transgenerational. Psora is traveling. Amygdala alert है पर नानी से, नानी में, नानी से माँ में, माँ से बच्चे में. Cause है, right? Why? Because amygdala ने किसको alert किया? Hypothalamus को. Hypothalamus ने किसको alert किया? The amygdala has alerted hypothalamus. Hypothalamus has alerted corticotropic releasing hormone, adrenal glands. Adrenal glands से epinephrine, nephrin, non-epinephrine. और उन्होंने क्या कर दिया? Fight and flight. So the child is born in fight and flight response. The child is born in amygdala alert response. That is why the birth cry was absent. There was no birth cry. The patient's mother was suffering from some problems in pregnancy. Vomitings. Why? Want of morsel. क्या? Throw out. क्या? कि नहीं, मैं ये लड़ाइयां नहीं. I do not want the quarrels in the home. Right? So, maternal stress. I do not want to be alone. Why I do not want to be alone? Because alone is traveling from generation to generation. First, my mother has gone. My daddy has gone. My bua has gone. Now, who will go? The alert amygdala is creating. If somebody would not be with me, what will happen to me? I will go. Panic. Right? Because already circuit is on. Death's ka circuit is on. The circuit is on. The mother is already in fear. I do not want to be alone. Right? I do not want to go. I want to be in a joint family, so that if something happens to me, there are some people who can take care of me. There are some people who can take care of my child. If I will be alone, who will take care of me? The patient's father was overworking. He was not having time for the mother. So mother was already very alone in a whole pregnancy. She could not share everything with the others. Okay? She was having a very close bond with the jethani, very close bond with the sister-in-law and mother-in-law. But if the father-in-law says to get separated, then what will happen? Then who will be with me? I will again get separated. Then I will be all alone. Then who will take care of me? This circuit has been on. This is what amygdala is giving the alert. Neocortex shut down. No rational thinking. Neocortex shut down. Emotional hijacking. Only what is working? Primitive brain. Only what is working? Thinking. Fear. Panics. Because the primitive brain is pre-programmed already from Parnani to Nani to mother and now to our child. That is why the child is like this. She do not, uska reaction kya aaya child ka? She does not like touching because Dada was strict. She has seen in the womb a strict male figure. She does not want father to be touched. Father did not came in pregnancy to the mother. No interaction of father and mother. So she did not like father. She did not like to interact with father. If father was there, she would be quiet. She would be fearful. If Dada would be there, she would be fearful. Why? Because her circuits, her amygdala is on from the mother. From the mother. She do not want to be, she wants somebody to be close, but she do not want touch. Touch also creates problems. Close, why she want? Because mother was feeling all alone. Right? So mother has given birth to a child in fearful state. And that is why the child is like this. Her lungs did not open when she came out in the world. Did not open. The brain was hypoxic. Hypothalamic pituitary axis on. And the physical, yani ke the body, jo Dr. Hahnemann ne likha hai, that the body has now thrown the mental diseases on the corporeal form. If you will see our patient, body pe koi problem nahi, no problem on the corporeal level. Only mind and emotions are disturbed. Only that level is affected. Right? No problem on corporeals. Okay? Because it is one-sided diseases. Now the whole thing has been taken by mind. The whole thing has been, the things have affected mind. Right? So the corporeal body, so when she took birth, the mind of the mother was upset. No physical problem. The mind has now created a child out of fear. That is why the child is like this, because she was in hypoxic brain injury. And the studies, this I would like to add, that when these hypothalamic pituitary axis gets active, cortisol gets active. This has been proved that in such kids, when the cortisol levels are checked in the hairs of the children, of the embryo and infant, and when you check those levels, those will be high. That means the mother has been under so much stress that the cortisol levels have been high in the whole pregnancy, that the pituitary, hypothalamus pituitary axis have been active in the whole 9 months. This shows that the offspring or the embryo which has been born was under stress, was under the mental stress of the mother. So this I have explained already. Mother got hemorrhage because she was feeling all alone and fearful. Vomitings because there was indigestible morsel that she had been all alone. She wanted somebody close. So it was indigestible morsel according to Dr. Hahnemann. She could not digest and she threw it out. OCDs like states in mother because of OCD comes out of fright. Scare जो हमने पढ़ा ना पीछे, OCD has come because of amygdala alert. So OCD scare fright mother में था कि if we will get separated, who will care for me? Who will be with me? Due to fearful state, birth cry was absent. Due to amygdala alert, amygdala ने alerted the hippocampus, and hippocampus ने memorize किया कि your mother has also died, your bua has died, your dadi has died. Now something will happen. Though that fearful state, birth cry absent for the child. Thumb sucking. Why thumb sucking comes? Thumb sucking usually comes when a patient wants the warmth of the mother, wants the warmth of the breastfeeding, right? So when this is not given to a child, the child is usually away from the mother, or mother could not give, then the child sucks the thumb. She sucks the thumb so that she feels as if mother is with me always. She feels the warmth of the breastfeeding. It comes. So our child was also in that, because mother in the pregnancy was feeling all kinds of neglections, aloneness. That is why she came with a thumb sucking. Now, according to GNM, according to Dr. Hahnemann, whenever ADD will come, attention deficit, our patient was ADD. It was not ADHD because she was not hyperactive. She was in attention deficit disorder, right? Hyperactivity was not there. In this condition, what Dr. Hahnemann says is, when this condition comes, it comes in two things. One is separation and one is stuck feeling. Separation conflict and stuck feeling. If it would have been ADHD, in which hyperactivity would be there, it would be stuck feeling because motor conflict will be there. Motor nerves will be affected and patient was more hyperactive to perform something. There we can take stuck feeling. But our patient is in separation conflict. That is why she is not hyperactive. She is in attention deficit. She wants attention because mother wanted attention. From whom? From the father, from the father-in-law, from the mother, from her mother she wanted, from her dadi, from her bua, but ultimately everybody died. So mother wanted, now this child wants attention. She is not in a performance. Her motor activities are not affected. So ADHD nahi hai. What is it? ADD. And that is why separation conflict. And we have seen that amygdala is alert because amygdala was in fear of separation. Mother ka amygdala was in fear that I would not get separated as I got separated before from my mother, from my dadi, from my bua. I do not want to get separated now from my joint family, from my jethani, from my sas, from my mother-in-law. I do not want to get separated. So this is separation conflict which came in the child, and that is why the child became attention deficit disorder, right? So is it linked? Am I making the link? Separation alerted the amygdala memory, hippocampus memorizes you have been separated from dadi bua. Amygdala created more alert and the child is born with a separation conflict. So after giving medicine, I took the rubrics later on. But after giving medicine, I gave a medicine, and after giving medicine, this is the version of the mother. So usually these patients in which you will see what these conditions are. In patients में you do not have to catch what the patient behaves. Is she not responding to the teacher? She is aggressive to the teacher. She does not like touch. From the father. Why? Because these are the symptoms of ADD. Must be common in about from 150 to 60 patients, right? We have to catch why it is happening. We have to go back. So we are giving the captions down for the people who do not understand Punjabi. The conversation is in Punjabi. The mother is explaining everything in Punjabi. We have captioned it down, right, for your convenience. किस दिक्कत ਨਾਲ ਲਾਈ ਸੀ ਤੁਸੀਂ ਇਹ ਨਾ ਛੋਟੀ ਇਹਦੇ ਮਾਤਾ ਦਾ ਦਿਮਾਗ ਨਾਲ ਥੋੜਾ ਜਿਹਾ ਪ੍ਰੋਬਲਮ ਸੀ ਕਮਜ਼ੋਰ ਸੀਗਾ ਜਾਨੀ ਬ੍ਰੇਕ ਦੀ ਤੋਂ ਡਰ ਜਾਂਦਾ ਜੇ ਕੋਈ ਉੱਚੀ ਆਵਾਜ਼ 'ਚ ਗੱਲ ਕਰਦੀ ਸੀ ਫੇਰ ਵੀ ਡਰ ਜਾਂਦੀ ਸੀ ਦੋਰੇ ਪੈਂਦੀ ਸੀ ਹਾਂਜੀ ਉਹ 7 ਮਹੀਨੇ ਦੀ ਸੀ ਅੰਗਰੇਜ਼ੀ ਦਾ ਦਿੱਤੀ ਸੀ ਹਾਂਜੀ ਅੰਗਰੇਜ਼ੀ ਦੀ ਦਿਨ 2 ਸਾਲ ਖਵਾਈ ਲਗਾਤਾਰ ਉਹਦੇ ਨਾਲ ਠੀਕ ਹੋ ਗਈ ਉਹ ਪ੍ਰੋਬਲਮ ਹੈ ਠੀਕ ਹੈ ਉਸ ਤੋਂ ਬਾਅਦ ਕੀ ਦਿੱਕਤ ਆ ਗਈ ਫਿਰ ਇਹ ਜਾਨੀ ਮਤਲਬ ਹਰੇਕ ਚੀਜ਼ ਤੋਂ ਡਰਦੀ ਹੁੰਦੀ ਜੇ ਬੱਚੀ ਇੱਕ ਪੈਣ ਖਾਤੇ ਜਾਂ ਛੋਟੇ ਜਾਨੀ ਫੇਰ ਵੀ ਡਰ ਜਾਂਦੀ ਠੀਕ ਖੜਾਕ ਦੇ ਮਨ ਸੌਂਦੀ ਠੀਕ ਹਾਂਜੀ ਤੇ ਹੁਣ ਕੀ ਫਰਕ ਲੱਗਦਾ ਹਾਂਜੀ ਹੁਣ ਤਾਂ ਜਾਨੀ ਪਹਿਲਾਂ ਨਾਲੋਂ ਬਹੁਤ ਸਟਰੋਂਗ ਹੈ ਕਿ ਸਟਰੋਂਗ ਮਤਲਬ ਕਿਤੇ ਜੇ ਕੋਈ ਚੀਜ਼ ਡਰ ਕੇ ਰਹਿੰਦੇ ਫਿਰ ਕਹਿੰਦੇ ਮੈਂ ਸਟਰੋਂਗ ਆ ਮੈਂ ਡਰਦੀ ਠੀਕ ਹੈ ਹਰੇਕ ਨਾਲ ਗੱਲਬਾਤ ਵੀ ਕਰਦੀ ਆ ਠੀਕ ਹੈ ਹਾਂਜੀ ਹੋਰ ਕੀ ਫਰਕ ਪਿਆ ਹੋਰ ਜਾਨੀ ਜਿਵੇਂ ਇਹ ਸਰੀਰ 'ਚ ਕਮਜ਼ੋਰੀ ਸੀ ਸਿਰ ਦਰਦ ਕਰਦਾ ਹੁੰਦਾ ਸੀਗਾ ਉਹ ਵੀ ਠੀਕ ਆ ਲੱਤਾਂ ਬਾਹਾਂ ਸੌ ਜਾਂਦੀਆਂ ਸੀ ਉਹ ਵੀ ਠੀਕ ਆ ਨੀਂਦ 'ਚ ਤੁਰਦੀ ਸੀਗੀ ਇਹ ਉਹ ਵੀ ਠੀਕ ਆ ਨੀਂਦ 'ਚ ਨਹੀਂ ਤੁਰਦੀ ਹਾਂਜੀ ਹੁਣ ਤੁਰਦੀ ਠੀਕ ਹੈ ਮਤਲਬ ਪੜ੍ਹਾਈ ਸੀ ਪਹਿਲਾਂ ਪੜ੍ਹਾਈ ਬਿਲਕੁਲ ਨਹੀਂ ਸੀ ਬਿਲਕੁਲ ਨਹੀਂ ਧਿਆਨ ਦਿੰਦੀ ਸੀ ਹੁਣ ਵਧੀਆ ਪਹਿਲਾਂ ਕਿਸੇ ਨਾਲ ਬੋਲ ਲੈਂਦੀ ਸੀ ਜਿਵੇਂ ਕਿਸੇ ਨਾਲ ਨਹੀਂ ਬੋਲਦੀ ਸੀ ਵੀ ਪਾ ਲੈਂਦੀ ਸੀ ਹੁਣ ਹਰੇਕ ਨਾਲ ਗੱਲ ਕਰਦੀ ਚਲੀ ਜਾਂਦੀ ਸੀ ਕਿਤੇ ਹਾਂਜੀ ਨਹੀਂ ਕਿਤੇ ਮੈਨੂੰ ਛੱਡ ਕੇ ਕਿਤੇ ਨਹੀਂ ਜਾਂਦੀ ਸੀ ਓਕੇ ਹਾਂਜੀ ਹੁਣ ਤਾਂ ਜਾਏਗੀ ਹਫਤਾ ਰਹੀ ਹੁੰਦੀ ਹੈ ਠੀਕ ਹੈ ਥਕਾਵਟ ਕਿਵੇਂ ਰਹਿੰਦੀ ਸੀ ਪਹਿਲਾਂ ਜਾਣੀ ਮਤਲਬ ਚਾਹੇ ਕਿਤੇ ਵੀ ਜਾਈ ਬਹੁਤ ਥਕਾਵਟ ਕਰਦੀ ਸੀ ਕਿ ਆਪ ਪੈ ਜਾਂਦੀ ਸੀ ਹੁਣ ਠੀਕ ਰਹਿੰਦੀ ਹੈ ਠੀਕ ਹੈ ਕਿਸੇ ਨਾਲ ਗੱਲਬਾਤ ਕਰਨ ਨੂੰ ਵਧੀਆ ਲੱਗਦਾ ਹਾਂਜੀ ਹੁਣ ਹਰੇਕ ਨਾਲ ਜਾਣੀ ਮਤਲਬ ਕਹਿੰਦੇ ਹਰੇਕ ਰਿਸ਼ਤੇਦਾਰੀ 'ਚ ਜਾਵਾਂ ਉੱਥੇ ਜਾਵਾਂ ਉਹਦੇ ਨਾਲ ਬੱਚੇ ਨਾਲ ਖੇਡਾਂ ਜਾਂ ਕੋਸ਼ਿਸ਼ ਕਰਦੀ ਹੈ ਮਤਲਬ ਹੁਣ ਡਰ ਵੀ ਖਤਮ ਹੋ ਗਿਆ ਧਿਆਨ ਵੀ ਲੱਗਦਾ ਪੜ੍ਹਾਈ ਦੇ ਵਿੱਚ ਥਕਾਵਟ ਵੀ ਠੀਕ ਹੈ ਦਿੱਕਤ ਕੀ ਰਹੀ ਕਿ ਸਭ ਕੁਝ ਠੀਕ ਆ ਹਾਂਜੀ ਮੈਨੂੰ ਤਾਂ ਜਾਨੀ ਪਹਿਲਾਂ ਨਾਲੋਂ ਬਹੁਤ ਫਰਕ ਹੈ ਪੜ੍ਹਾਈ ਦੇ ਵਿੱਚ ਕਿੰਨਾ ਕੁ ਫਰਕ ਪਿਆ ਪੜ੍ਹਾਈ 'ਚ ਪਹਿਲਾਂ ਨਾਲੋਂ ਬਹੁਤ ਜ਼ਿਆਦਾ ਫਰਕ ਕਿਵੇਂ ਕੀ ਫਰਕ ਲੱਗਾ ਪਹਿਲਾਂ ਤਾਂ 2 ਨੰਬਰ ਲੈ ਕੇ ਕਿਸੇ 'ਚ 3 ਨੰਬਰ ਲੈ ਕੇ ਹੁਣੇ ਜਾਨੀ ਮਤਲਬ 16 17 20 ਨੰਬਰ ਏਦਾਂ ਦੇ ਵਧੀਆ ਜਾਨੀ ਪਾਸ ਹੋ ਜਾਂਦੇ So this is the result what we have given medicine. After result she was perfectly good in studies, she was very well in socializing, her social behavior was very good, she used to interact with everybody, and moreover now father's touch was also permitted. She was very well with she did not reacted to father's touch, she was not fearful of father, and she has allowed the father now to touch her also. So this is the beauty of homeopathy, when we catch the root cause, when we catch the Psora, what Dr Hahnemann says, that you have to get hold of the Psora which is traveling from above downwards. So the rubrics which I took were death, ailments from, the death which the mother has seen, dadi, nani has seen, nani has seen, animals मैंने इसलिए लिया because the mother in her pregnancy saw dada as an animal who came and threw things and he was very aggressive. Thirdly, I have taken the main core rubric alone, which the mother has felt since, and nani has also felt, and the mother's mother also felt for nani. Fear injured of being. The child was very fearful that somebody would not injure her, somebody would not touch her, somebody would not come close to her, right? And held desire, because she was very closely and very fearful, and she wanted held desire. And mother also wanted in pregnancy that somebody should be with me. I do not want to get separated. I want to be in a joint family. And salty things desired for. And I gave her Kilcaria Ars, a component of Kilcaria combined with arsenic, because she was very fastidious. She liked cleanliness and neatness, and the result is in front of you. The child has become normal, and moreover, she's going to a normal school for studying. The teachers have accepted her, and she is very, very good in studies now. As the mother says, now she is cured. So this is what I wanted to bring you to your knowledge, that we do not have to catch the symptoms, we have to get hold of the Psora, right? I hope that you all understood. I hope that what I wanted to convey you from my lecture has been conveyed very well, and it will be helpful for you in your practice, in your daily routine practice. You can differentiate EBD children. You can differentiate internalizing EBD and externalizing EBD, and you can even see that your medicine has brought behavioral good positive changes after giving medicine in the children. You can see the results also, and hopefully it would have been a good session for you all.